Assalamu alaikum wa rahmatullahi wa barakatuh. This is Pregnancy to Parenting. I'm Khawa Solomon and welcome back. I'm joined once again by Dr. Malika van der Skeef. If you're following the show, we are in episode 5, still within the first trimester. Last week we dealt with the visit to your gynae, choosing a gynae, what you need to know, what you need to ask her or him at your consultation visit. Now we're looking at the end bit of, well, not completely the end bit of the first trimester, but still within the first trimester, some of the danger signs and you need to look out for. Alhamdulillah, we will recap on the multivitamins, what you need to eat, what you don't need to eat if you've missed that, just quickly with Dr. Malika. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
And welcome back. Shukran so much for joining us. So if we look back a little bit to last week's show, we dealt with, and we're still within the first trimester. Just to recap quickly, the pros, the no's, and the yes when it comes to multivitamin to eating and not eating.
Just as a quick recap, yes, what we were discussing last time was multivitamins, saying that, there are many different brands out there. Choose a pregnancy multivitamin, saying that there are those that are even halal certified, so that can suit your needs as well. That there are different formulations that can sometimes combine the pregnancy multivitamin as well as an omega. And it'll be a combination of either omega 3, 6 or 9. So those can come as combo packs, or you can sort them out separately. And then what we were saying also most essentially is, if you cannot manage to get to a multivitamin, for the very least to try and be on some of those small little yellow folic acid tablets, which are relatively inexpensive to try and get, and often are the ones that the clinics and the public sector clinics would hand out anyway, as well as those multivitamins that they might hand out at the public sector as well. So that would be the vitamins. When we were going through the don'ts, it was basically, just as a quick recap, it was your raw fish, bearing in mind that tuna in a can is not a raw fish. It was also your smelly cheeses, Camembert Brie, Rochefort, matured cheeses, blue cheese with the little kind of mold around the side. That your processed cheeses, your cream cheeses, your feta cheeses, those were okay. We spoke about raw egg and hors d'oeuvres and how to avoid those and to make sure that you actually cook those things well, or buy them where they've gone through quite stringent quality control and just from a reputable place where that's concerned. And basically just discussing that the biggest deal where some of this is concerned is that you worry about food poisoning as well happening. And then of course we did mention the no-nos, such as your smoking and alcohol, drugs, toxins, any of those that are an absolute no-no. And part of the toxin no-no sometimes was your heavy caffeines. So staying away from the caffeinated energy drinks or your caffeine soft drinks, and probably doing diet caffeine-free soft drinks, and if possible your rooibos teas or your caffeine-free teas. And if you are going to be desperate for that cup of coffee, one good cup of coffee a day and leave it at that.
Just quickly, which I didn't think of the last time, was the green teas that everybody's so highly potent about. So the green teas, that's got the caffeine in?
That's a no-no as well. I mean, I know most people are shocked to hear that your green tea actually can have. And it's a marvelous tea otherwise for its antioxidant properties and things. But in pregnancy, try and avoid.
Right. So now looking at some of the symptoms, and one of the big symptoms is this, and if you haven't suffered from nausea, then that's a great thing.
Absolutely.
So, but there are lots of pregnant women that suffer from nausea from the start go right up until the end. Help us understand the process of what actually happens to the body when you are experiencing nausea within the pregnancy, even from the beginning stages. And I know that you love your mommies to be nauseous, but what actually happens to the body, and how can we help that
as I said,
process?
And as I'm always saying, I sound nasty sometimes to patients when I say, when they sit in the practice and go, I feel miserable, I feel horrible, I feel nauseous, and when they're busy being pregnant. And sometimes I know that sounds like a terrible thing to say, but us obstetricians sometimes love hearing that, because that nausea actually alerts us to a sign that things must be growing. And as I'd mentioned in the previous program, that your nausea gets triggered because of the hormones that are around, and that it triggers that, and it's often your progesterone hormone that's around that's triggering that nausea as well. So that's sometimes why some patients who end up not being pregnant but having a ovarian cyst can, because of that hormone release, think that they're pregnant and then they're not pregnant. So it's basically that hormonal input that causes that and triggers the nausea. And often also, you know, your olfactory senses are so sensitive and acute that your nausea can also just get triggered with certain smells that would irritate that center within the brain. And also, that's why some people would say morning sickness as well, because you actually get out of bed, you're jumping out of bed to either get, you know, prepare breakfast, or you're running late, or you want to just, you know, you're just so used to being on the go, and then you don't realize that sudden change, you know, with those sudden changes that happen in the inner ear, and that sudden changes of your blood pressure from being laying prone and then suddenly getting up can also trigger your nausea. So that's where some of the remedies can come in, based on kind of saying just slow and do your movements slowly where that's concerned. So it is a marvelously natural part of pregnancy. I sound utterly horrible when I say it, but at least when you're sitting in front of me and saying that you're not nauseous, I sometimes worry. And I love to hear that the pregnancy symptoms of breast tenderness, nausea, you know, tiredness, fatigue, the smells, I love hearing that, because it means that that pregnancy is busy growing. Having said that, some patients are lucky that they really are blessed, alhamdulillah, and can manage to get through that first trimester still feeling quite normal. I just can't tell you who those lucky few are going,
because that is going to be my next question. What are they doing?
Yeah, no, I'm not quite sure what they're doing either, but one of the ways is actually to try and rehydrate yourself when you are able to, because it becomes this entire snowball effect that's happening, because you start out with a nausea and then it just worsens because you're not eating, and then that nausea triggers in. So it's, you know, it can just worsen if you aren't able to kind of get ahead of it. And that's why some patients can be so excessively nauseous that they actually need to be admitted for IV or intravenous rehydration, you know, as well. So some patients are lucky that it lasts for a little while, and some patients there are a few, and again, I can't predict who those few are, who are going to be nauseous probably throughout that entire pregnancy. You know.
Not morning sickness.
I know, it's like the entire sickness. And some people say, oh, mine is more evening and things. But sometimes that nausea is triggered just in the first trimester. And there are certain few where sometimes it comes back right towards the end of the pregnancy again, you know. And often outside of the first trimester, if your nausea returns, one of the things we look out for is, could it be a urinary tract infection? Could there be food poisoning? Is there something else bothering you? Recently, there's been this horrible viral bug going around where the first sign was nausea. So, you know, it's different outside of the first trimester. In the first trimester, we still think it's physiological.
All right. So those things that help with the nausea, I know there's medication out there. And, you know, is it possible for moms to take those medications? Is it safe? And the odor that often comes to your door as well. What is your advice? Old wives'
tales as well. You know, there's a lot of validity in some of those tales, and we'll get into that. But to say that pregnancy, you know, often patients are trying to avoid medications and things. And the package inserts on some of your medication would always say, safety in pregnancy not established. We are very much of the opinion that to try and prevent that admission and that hospital admission for nausea, you know, if we can prevent that early by giving you an antiemetic or an anti-nausea medication, we can. And there are those which are acceptable in pregnancy, and we ideally cannot give it to you for weeks and weeks and weeks in advance, you know. So I often start with the kind of huisraadjies or old remedies and things. So it sounds like a nasty thing to say, but don't jump out of bed immediately. You know, kind of sit up slowly, move slowly with legs off, kind of very oldish kind of movements, slow movements, just try and just balance that blood pressure that might be changing because you're up and about. And, you know, I often say, you know, sit up, either keep something like a biscuit or a cracker next to the bed, nibble on that before you get up, that kind of thing. Or, get your partner or your hubby to get you that slice of toast with jam or something, that
even
breakfast
better.
in bed, that would be even better. But that's not always feasible, ideal in today's stage. And then I sound horrible when I say it, and it sounds gross, but perhaps don't brush your teeth almost immediately. Because sometimes,
I remember that
menthol or that pepperminty smell just triggers your nausea as well. We sometimes say have something solid before something liquid, so that also doesn't trigger nausea as well. And try not to starve yourself as well. So you might find that you end up having vitamin water or energy and caffeine free, obviously, energy drink, or having lots of sugars and things as well, just to help keep that nausea at bay. Sometimes I find that patients will say chewing a bubblegum or pepperminty kind of sweet can take that funny metallic taste out of the mouth, or perhaps some peppermint teas and things. And the one big area that I haven't spoken about is ginger. Ginger biscuits, ginger
I was going to bring it up.
Ginger tea, ginger, you get these wonderful little ginger bonbons and sweets and things. So that is actually, those omens, reikis, and those old tales that have come from generation actually is true. It really does help to try and kind of stop that nausea. And you even get priggy lollipops, which are ginger flavored, to try and stop that kind of nausea, And as you can see, nausea can take up an entire
segment or show
session. Absolutely.
So looking at constantly keeping those meals, those tidbits of biscuits and ginger and stuff at your bedside will definitely help with the nausea. Inshallah. We'll be back with more with Dr. Malika van der Schijf just after this. This is Pregnancy to Parenting. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Pregnancy to Parenting. I'm Khawa Solomon. Thank you so much for joining us. With me as we continue our first trimester in pregnancy is Dr. Malika van der Schijf, obstetrician and gynecologist practicing here in Cape Town, Constantiaberg and Rondebosch Medical Center. Welcome back, Dr. Malika. Just before the break, we looked at the big issue of nausea, trying to find that perfect remedy.
The commonest complaint in the first trimester.
Hoping that it's just morning sickness. Lo and behold, it's not. It goes right through the day throughout the pregnancy. So hopefully, inshallah, try and be supportive through all of that with everyone involved with regard to that pregnant mommy during your first trimester. So now looking at getting sick. Nausea basically feels like you are ill. You feel ill all the time. So what about the other little ailments, like, the flus and the sniffles and the nasal congestions and all of those, the sinuses, and as well as dealing with sick people? Can you go and see them and all that sort of things? I'm going to visit people in hospital. How does medication, or can medication be taken when the pregnant mommy is ill during the first trimester?
Often that is one of the important questions I get asked about. What can I take, what can't I take, and things like that. And often there are minor ailments in pregnancy that might happen, which, for example, as the seasons are changing, we'll often find patients, and especially down here in the Cape, will complain of allergic rhinitis or stuffy noses, postnasal drips. They might complain of sinusitis with sinus headaches and just generally feeling congested. There are certain, especially where those things are concerned, as well as your cold and flu, you're really stuck in that you cannot take your cold and flu remedies, or a lot of the sinus remedies, which end up drying up sinuses and the mucous membranes and things, will have an effect on the pregnancy and the fluid around the baby where that's concerned. So, your normal kind of flu remedies and that, often not a good idea for a couple of reasons, partly because of what I've just said about the decongestants or which is in them, but also because some of them don't have paracetamol in them, but they'll have your equivalents of your aspirins or Disprins or things in that. And if we're dealing with a kind of anti-inflammatory or an antipyrexial, meaning to break your fever, you're basically stuck with your paracetamol, as being for either a headache, a sinus headache. And, often patients will say, paracetamol never works for me. I'll take 2 tablets and it does nothing. And they're often resistant to listen. I often say, please try it anyway, because the way your body absorbs things in pregnancy is a little more sensitive and more obviously different. And you're more able to perhaps find relief from that small remedy, even though outside of pregnancy you'd pop it and it wouldn't do anything, a thing. So that, and then, so with your stuffy noses and things, you've got your saltwater nasal sprays. You also have, which is perfectly fine. And that takes those kind of sinus congestion and little nasal pads and that are inflamed, and it will actually help to alleviate that. So that would be one remedy as well. Bearing in mind that some of your nasal sprays can be allowed, but please just check with your doctor, because you also don't want to be in a state of feeling nauseous plus stuffy and unable to breathe and unable to eat. That's just terrible. So there are remedies. Never believe, and apologies for using a double negative, but there is never nothing. Because you'll find that patients will go, oh, I know there's nothing I can do, and then they don't do it. You can absolutely, for a cold, or if you think colds or flus or sore throat, you can actually gargle with your normal kind of mouth gargles, or the gargles that are available can be used, because you are going to be spitting that out. You are going to be you're not going to be ingesting that, because that's where the problem comes. You can do your lozenges, which is, for example, your lemon and honey or orange and honey lozenges. Just beware of the lozenges that has a lot of menthol in it, and lozenges that have a lot of local anesthetic in it, because we worry that the way your body is going to absorb it might close down the throat. So that's where that comes in. But you can still gargle with those things. Don't gargle with half an aspirin or Disprin or things, because those things would be absorbed. That's what we'd said was a no-no. So, there are certain remedies, and there are certain homeopathic formulations that you can do from a sinus point of view, or throat, or things like that. Some of your classic flu medications, as I said, may not necessarily be taken, but the components you can make up. You can have 2 paracetamols. You can make yourself a lemon, ginger and honey drink, because the vitamin A's and the natural antibacterial properties of all of those 3 with some boiling water can actually just help. And the one thing that people forget, and women forget where colds and flus are concerned, is do not forget to rest. Because something as simple as a cold and flu, you can manage normally, you can still go to work with things, but we are getting more resilient bugs that are hitting us, hectic strains. Plus, we're also getting, in pregnancy, you just feel as though you've been run over by a truck most of the time, and you don't realize that you just need to sleep it off.
And often people say, because you complaining all the time sometimes when you're pregnant, but that's also what it feels like. And then they would say, pregnancy is not an illness. But that's sometimes how all you feel. You feel sick. There are beautiful pregnancies. Alhamdulillah, I had a beautiful pregnancy with my second daughter. And I was like, I didn't even feel like I was pregnant. So alhamdulillah, we are blessed with that at times.
And so, as you can tell, not every pregnancy will dictate the same degree of symptoms. So, that's why I always advise, try and stay away from where you think people are really ill, kind of things. If and that's why I had mentioned in the previous program, good hand hygiene, perhaps in your workspace as well. Make sure that, good hand hygiene. So if everybody's touching the phone or things, antiseptic it if you can.
You will look OCD, but
I know you may look like that, but and also we sometimes guide you that please watch out, there's a horrible bug going around. Often, other than just food poisoning in the summer months, we often do have a diarrhea bug or diarrheal bug going around. Or if you've got little kids, they might pick up a bug and you might also pick it up from them at the same time. So I think, for example, there are certain products you can and you can't take. That, for example, where diarrhea is concerned, I'm not going to mention product names, but there are tablets, sachets, rehydration that you can take. Do not forget your paracetamols. Do not forget to check with your doctor what he or she would advise. Do not just automatically assume that there is nothing. There are safe things to use in pregnancy, and there are also just safe pieces of advice that can guide and help you.
All right. Now, looking at people that are sick, because you mentioned that, and I know you've mentioned it in the previous episode, looking at keeping general hygiene. But there's always a question like, do I go and visit my sick uncle in hospital, and my niece or my nephew has German measles, and this one has mumps? Just guide us through that.
Often those contagious diseases, I would absolutely obviously advise you to avoid. We will talk about blood tests again, but one of the blood tests which is standard in the private sector is to check whether or not you are immune to German measles, meaning have you either had it before or have you been successfully immunized? So in both of those, you formed an immunity to it. So you're able to fight it off, because those types of things do not happen as a second offense often. It's a once off, you form an immunity and you can fight it off. Having said all of that, I must be entirely honest with you, I don't know if I would necessarily then advise that you would be in hectic contact with people with those illnesses, because it might be secondarily infected, those little lesions or things. So I think in general, my advice would be avoidance of those who have anything that could potentially be contagious. We joked about it before, but not kissing anybody other than your hubby on the lips, kind of, just cheek, because this is how these things spread. It's oral kind of thing, with hands, with mouth, saliva. It's often the reason, why things spread, where that's concerned. And I think that, as long as you've been assured that people who you are visiting do not have anything hectically contagious, so for example, your active TBs, your active diseases, your funny multi-resistant bugs that unfortunately might be found in hospitals or things like that, and I think you may find that, those patients would check with their doctors, what would be safe.
Right.
And I think also, we're talking about a lot of these illnesses, but boosting and building your immunity. I mean, it's all over television, it's all over the advertising that as we head into our winter months or our autumns and things, up your vitamin C, up your antioxidants in your diets, your carrots, your gingers, your orange juices, things like that.
Fresh.
Assuming you can handle it, because we haven't even spoken about heartburn, assuming you can handle it where heartburn is concerned.
Okay, so that's another topic that we forgot to mention, but inshallah we'll deal with that after the break. Absolutely. Also looking at some of the mood swings. Maybe we can talk about that a little bit before we do go for a break, or do we have enough time? We need a whole segment for that.
I think the one thing that we don't, that might need a whole segment on its own, but the one thing we haven't spoken about is what happens from the neck up, kind of brain-wise, is please do not feel bad. Sometimes pregnancy can make you utterly forgetful, moody, mood swings, things like that. Often you're not the one telling me about it as the doctor. I'm often being told about it by the spouse or someone else. I think if I really wanted to give a piece of advice, because my patients laugh when I say this, I'd say the perfect cure for moods would be to get get a credit card and go shopping. But that's a bit that might not fit into your budget.
One that has an unlimited credit.
Absolutely. Just as some of these are just in the first trimester. And you won't feel as though you have this muddied, fuzzy brain that you need to get over. And part of that is linked to the hormones. Part of that is the dehydration, nausea, all of those. And also just the emotions that are swirling around knowing about this.
Well, I know that's not the end of the mood swing issue. We're going to deal with it a little bit later as well. Shukran so much, Dr. Malika. After the break, we will kind of wrap up our first trimester, also look at any questions and comments from our Facebook page as well, so please keep them coming, inshallah. So join us after the break to continue Pregnancy to Parenting. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Pregnancy to Parenting. I'm Hawa Solomon, and joining me once again is Dr. Malika van der Schijf. Doctor, just before the break, we looked at some of the nausea issues. We looked at, confirming the activities earlier on and as well, and getting sick, what to take, what not to take. We are so limited when we are pregnant. So try and maybe get to know a homeopath during this time of pregnancy. Maybe that'll help, inshallah. So now everything looks really pretty, and everybody's found out, and we have spoken a bit about the mood swings as well. So we in the doctor's consultation room, what can we see? What is happening? The scan, we're all excited about the first visit, and so what is happening on that scan, and what can you see?
Often the first thing we look for on a scan when we see the patient is to make sure that it is in the correct place. So to make sure that it is intrauterine, as in the womb and in the uterus. Because obviously if it's not in the womb, it is considered ectopic, as in outside of the uterus. And it can sometimes be in the tube and be a tubal pregnancy. And this can be a life-threatening condition. So, sometimes when we kindly kind of say, oh, everything looks fine, what we are saying is in the correct place. Is it the same stage and age that it's supposed to be? Is it actually, if it's measuring if you're 5 weeks from your last period, is it now actually measuring 5 weeks? And, often is there a heartbeat as well with that? Because that's obviously vitally important to prove that it's viable. And when we look at the different stages, often, I know I'd mentioned before that we can see things from 4 weeks onwards. So if everything is okay and, all the conditions are set, and bearing in mind the uterus is a cavity, so sometimes you cannot necessarily see in the one little corner versus the other, because we often do two-dimensional scans, not necessarily the 4D or the complete dimensional scans, 3 to 4D scans. So a 2D scan, you're looking at it and you're seeing that little sac. You would love to see a little bubble within the bubble. So you see the sac with its fluid, you see a little bubble within the bubble called the yolk sac, which is there to kind of feed the pregnancy as well, which is like the equivalent of saying the kind of yellow of the egg kind of thing. So the little yolk sac that's there as well. And you also end up then seeing the little fetus or conceptus. And depending on where you are, it's dependent on the different stages that you're seeing. So when you're at about 4 or 5 weeks, you see almost like 2 or 3 little equal to kind of signs, and then you can sometimes see the heartbeat starting in between that. And it's often very nice for patients to see the heartbeat. And the one thing that surprises them is that heartbeat goes, ours go about 60 to 80, our heart rate. But the fetal heart rate is double that and can go anywhere from 120 to 160 beats per minute. So if we're lucky enough, that stage we can see it. And then often, and that is often like half a centimeter. So you're dealing with like, at 6 weeks, it can be as small as 6 millimeters. So it just looks like this little grain of sugar or peppercorn kind of thing. And then as we go on to, and you'll find that in medicine, often in medicine, things get compared to food. So it initially looks like a little peppercorn or lentil, and then that would be about 4 to 5 weeks. And in between getting from there to looking like a little grain of rice or rice korreltjie, as we would say, is often around about 7 weeks. And when we get to about 8 weeks, and that's about 1 centimeter, and that when we get to about 8 weeks, that little fetus is about 2 centimeters. And often they look like a little bean, so they have that little kidney bean shape, and that's because the head ends up being almost as big as the body, because obviously the brain is busy formulating, the scalp is busy trying to form, the brain is expanding, and that tissue is being laid down and then condensed into the head. So they often look like as if the head is bigger than the body. And often at about 8 weeks they would look like that. Initially at the beginning of 8 weeks they'll look like these little beans, so like jelly beans, and then they look like jelly babies afterwards, because they look like these little kind of outformings of a little body with little limb buds just starting. So you can start to see that, and we sometimes can start to see little wiggles and movements and wiggles of the body as early as anywhere between 7 and almost certainly 8 weeks. And once you start getting in close to the teens and up to 9 or 10 weeks of that, they start looking like little alien or skeletons, and that's often where the head looks a lot bigger and the body looks small. And as we go, they then look like little skeletors or little skeletons up until you reach the end of the first trimester, when you can start seeing all of the different bones that have now formed, and you can start seeing, the bony outer structure, and they often look very much like little skeletons because that muscle layer is still so thin and there's no fat layer there, and the skin is actually almost translucent.
And
so
then how big is the little fetus at that
often
stage?
at that, as we're getting to about anywhere between 10 to 13 weeks, there will be a similar kind of length, so anywhere between 10 to 14 centimeters in length where that's concerned. Obviously, depending on how big or small you are tall genetically where that's concerned. And then often from about 10 weeks onwards, you from early on, you can start seeing that little umbilical cord already connecting to the placenta, but that placental function starts to take over as we head into the end of the first trimester. And that's why we sometimes say that you hope that nausea is going to get better, or all of those symptoms are going to start getting easier as we start
calculating the first trimester. How long is that? Is that the 3 months? Or
yes, that is your 12 completed weeks where that's concerned. And often as you're heading towards the end of that, patients will often ask me, when should we tell? When is a safe time to kind of tell? And although miscarriages and that can happen at any point, we often say that, if you've gone to between 10 and 12 weeks, that's not a bad time to kind of, tell.
Because then the heartbeat is still.
Absolutely. And you've gotten through most of the first trimester. Often sometimes that's only, couples have only found out a week or so before. But, a lot of couples are often hesitant to advertise absolutely right at the beginning, just because you want to see that everything is going well in that pregnancy.
So throughout this beautiful stage of life, there are some pitfalls as well. Talk to us, what could possibly go wrong during that first trimester?
Well, one of the first things that, we use the word often is the word viability. As in, is everything actually okay or staying okay? And you'll find that your doctor may say to you, oh, everything looks fine, but kind of your definition of fine is a checklist you're doing in your head. So as I was saying, is the pregnancy in the correct place? So firstly, you have missed 5 weeks. It's been 5 weeks since your last period, or 6 weeks, and you're hoping to have to see that little bubble, and you're just, what can happen is, the most important thing is you want to see something in the uterus, firstly. You also want to hear as the doctor that there hasn't been any bleeding, any blood, so that definitely in our history and in our examination, you want to know that you're actually seeing that little sac and that you're not seeing it in the wrong place, in the ovary, in the tubes, or even the ovary for that matter, in the tubes, because that is your ectopic pregnancy. Because whether that pregnancy is growing or not, it can almost never grow to a 9-month pregnancy in that tube. And that's one of the big dangers, is ectopic pregnancy, that it could potentially be in your tube. And the way to alert you to those symptoms, other than the pregnancy symptoms, because you may still have the pregnancy symptoms, is, do you have constant pain on the one side more than the other? Because that might be, because if it has now gotten stuck coming through that tube, and it's gotten stuck in that right-sided tube, that is where often your pain would happen. And because the tube is very small, if it implants on that, it could burst, and that pregnancy is growing, it could burst through that tube and you start to pour blood into your abdomen. And that is a major emergency where you are doubled over in pain, or, nausea, vomiting, absolute pain, totally crunched over, unable to kind of sit back, and just obviously getting paler and paler because you're bleeding into the abdomen. So those are one of our big emergencies that makes us really run. And those are the kinds of things that get our pregnant patient, to the emergency room, when there is a major problem with the pregnancy.
Shukran so much, Dr. Malika. We are going to tap more on the dangerous signs within the first trimester. Please stay with us. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back. This is Pregnancy to Parenting. As we ending sadly our first trimester, once again we're chatting to Dr. Malika van der Schijf. Shukran so much and welcome back, Doctor.
Your pleasure.
Okay, so we're dealing with the pitfalls within the first trimester. And we have to talk about this so that we can be aware and, they can, whoever is around us, offer the helpful support that is needed, inshallah. So the emergency that you mentioned before the break. Okay. Anything else you wanted to add to that?
I think, that was one of the major emergencies that I was mentioning about an ectopic pregnancy and how when we say everything's fine, we mean hopefully that it's in the correct place. Unfortunately, sometimes even if the pregnancy is in the correct place, it might not grow correctly. There might be problems around the growth, and there's certain things that even in the practice or in the consultation can alert us. Which, for example, it would be if you've come to the practice and said that you haven't had your period for about 2 cycles or 8 weeks. It's been 2 months since your last normal period. Then, as I explained before, ideally you need to see this 2 centimeter little fetus with good heart rate, things like that. And often, as I said, in the history, you alert yourself with, are there pregnancy symptoms? Because sometimes you can have different forms of pregnancy loss or different forms of miscarriages. One of the ones that can happen where you don't even form the fetus is called blighted ovum. Which means that what happens is the sac ends up growing. Your pregnancy test might still be positive. So that egg and sperm had gotten together, it had gotten into the womb, but it didn't implant, nothing formed, or didn't implant well enough and nothing formed. So sometimes you can have this empty sac with nothing inside of it.
So fertilization took place and everything?
It's more that, yes, it did, but not correctly because, and the reason why it's called blighted ovum is because that the egg was perhaps either having aged or was already starting to die or for degenerate. So, the initial processes took place, but the pregnancy couldn't go any further. So you can still feel all pregnant or not feel pregnant at either. See that little sac, and it can continue to grow probably for about anywhere between 6 to 10 weeks until your body realizes that there's nothing growing. And then, a miscarriage sometimes takes place. And that's because, as I'd mentioned before, your ovaries are taking over initially until the placenta, which is your placenta is your direct link between the baby and your body, with that umbilical cord in between. So once your body gets to a stage realizing that hasn't happened, you might sometimes have bleeding as well. And those are often called the blighted ovum or the false-ish kind of pregnancies. And the women who are at risk, I'm sure that was going to be your next question, the women who are at risk for this can be those with an irregular cycle, where ovulation did not take place correctly. Sometimes it can be linked to age as well. We had in previous programs mentioned, kind of the younger you are, the sort of more fertile or more viable the eggs can be and their quality. So it's more about the quality of that egg that was not good.
And that's why we touched on the fertility issue and
Absolutely.
the age
Yes.
at that time. And you spoke about bleeding, and I don't know, whether we should be dealing with this right now or later on in the pregnancy, but can you actually still continue to have a period and be pregnant?
That is one of the things that worry us sometimes with regard to that ectopic pregnancy, because your womb doesn't realize that the pregnancy has happened there. So you're having that same changes happening with the bleed happening regularly and having that pregnancy. So, and in the tube. So that's why we always say, if a woman presents with bad pelvic pain and she's within that age area, do a pregnancy test. Do not just assume because she has her period or what she thinks is a normal period that she couldn't possibly be pregnant. So that's sometimes the bad sign. One of the good signs is that sometimes you can have, and you've heard me mention this before, I say your last normal period. Because sometimes what can happen at that same stage of implantation, you can have a little bit of an implantation bleed. So when you question the patient, they'll say, my last normal period was actually about 2 months ago, but about a month ago, I just had a few spots or drops for a few days or something. And that can sometimes be what some patients say, bleeding pregnancies and things as well. And not to forget, I haven't gone into sometimes the mouth of the womb or the cervix, you can have a local bleed that has nothing to do with the pregnancy. It can just be because there's been inflammation or an infection on the cervix. And then sometimes those can be the women who talk about my bleeding pregnancy or I had blood and things. And of course, that is one of the things and the danger things to look out for when you're pregnant.
So there's
which
not
makes it an immediate distress is bleeding in pregnancy.
So it's not really a period that you're getting throughout your pregnancy.
No, it's not really that at all. It's, some patients it can be because the placenta's laying low, it can be because, they have an infection or perhaps thrush infections, or there's a lesion or problem on the cervix or the mouth of the womb where that's concerned. So we never like hearing the words bleeding in pregnancy. And it is one of the things where if a patient in the first trimester calls, one of the things you want to do is see them scan, check what could be causing the bleeding, because you do have causes for miscarriages as well.
Miscarriages, that is also a big topic within the first trimester, and I want to look at that now. I've had an experience with regards to a voluntary miscarriage where they, the pregnancy was not viable.
Yes.
Talk us through those sort of aspects as well.
Your different stages of miscarriage would be, descriptions of miscarriage. Bleeding, you worry. So you come to the doctor. We check and assess, is that mouth of the womb open or closed? If the mouth of the womb is not opened, as in rejecting the pregnancy, if the pregnancy is still growing, we've seen the heart rate, we've seen everything looks fine on scan, alhamdulillah, that is what we call a threatened miscarriage. So then I often end up instructing the patient to go and rest, bed rest, keep legs up, no romantic evenings or sex for at least till we advise or until we rescanned you or checked. Often that'll be anywhere between 10 to 14 days kind of thing, if not longer, depending on what kind of risk category you're in.
And this is all within the first trimester?
This is all still within the first trimester. Miscarriages can happen within the second trimester as well, but I'm dealing just with the ones that, in the first trimester when it's still quite fragile, where, if it's bleeding, that's one worry. But if it's bleeding with associated terrible cramps, that can also alert you to a miscarriage. Also sometimes the cramps can happen first before the bleeding sets in. So I'll sometimes have patients who would come with major cramps and pains, and then on checking, unfortunately, there might not be a heart rate or a heartbeat. And sometimes if you've never had a pregnancy before and you haven't seen that little heartbeat, and you haven't seen that little flutter of 120 to 140 beats a minute, it's sometimes very difficult for you to believe us and say, what? We don't see a heartbeat. So those ones where we don't see a heartbeat is sometimes classified as called a missed miscarriage, meaning that it is, the fetus has now stopped growing, the heartbeat has stopped, And then those are the ones that you were discussing now, where we know that this pregnancy is not viable. We know that if your bleeding gets pouring or gets worse, that you actually can land up in a very serious situation and a dangerous situation of losing a lot of blood and being in excessive pain. So what we do where that's concerned would be what you were saying, like voluntarily then, after counseling you that this is not a viable pregnancy, to say that. And it's not, it's not a procedure we do lightly, we often do advise doing that.
Okay, so what is the procedure then, and what does that procedure involve?
Well, that would be having to clear the lining of the uterus and actually doing a womb scrape. So it would be you being anesthetized, clearing the lining of the uterus, which is often quite traumatic afterwards for the patient.
Okay, shukran so much, Dr. Malika. Inshallah, we will recap in our next episode a little bit more on the last bit of the first trimester. It was always a pleasure having you. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
And from myself, Hawa Solomon, in this edition of Pregnancy to Parenting. See you next time.